Hello, my name is Desmond Jumbam, and you're watching Impact Voices. My name is Desmond Jumbam, and I'm a health policy consultant with a focus on global surgery. So I think of impact at two levels. There's first the individual level. At the individual level, impact is seeing somebody live out their full potential. If it's seeing someone who starts off in poverty, who starts off in the most dire situations, and having them being lifted out of poverty to live out their dreams and have the capacity to earn for their families and provide for their communities. So that's at an individual level, and they become prosperous as individuals. But at community or societal level, I see impact as introducing programs, introducing policies, writing that is able to change the way people think about a particular topic, the way we relate to each other, the way we live together as a society. And ultimately, it's helping us as humanity get towards, a better community. Okay, there are a couple of things that I'm doing to create impact, or at least I hope that will create impact at the larger level. So what I do is I focus on global surgery. So we know that 5 billion people around the world don't have access to essential surgery. So there's an increase in trauma from road traffic accidents, especially in our parts of the world like Cameroon, but also in places like Southeast Asia. There's still high maternal mortality from women dying from either lack of access to a facility that can provide them C-section, or when they get access to a facility, the quality of the care that they get is poor. So I'm particularly interested in improving this, and how I do that is I work with governments and ministries of health in Africa, advising them on policies that will systematically improve surgical services so that any woman, be it in Tanzania or in Cameroon and in Ghana, who needs access to a C-section, or a child who falls and breaks their arm, can have high quality essential surgery that they need to survive and get back to the communities to be productive. The work that I've done so far, one example is I've worked with the Ministry of Health of Tanzania to develop what they're calling a National Surgical Obstetric and Anesthesia Plan. And this is the first plan of the sort in Tanzania. The aim of that plan is to improve access to surgery for the entire country, and it's a $500 million plan that the Ministry of Health of Tanzania is working with development partners to implement. But even with that, I've been able to advise other ministries of health in Pakistan and Namibia and Zimbabwe, for example, on very similar policies. But I also currently work with an NGO, a non-governmental organization called Operation Smile, that is in 33 countries. That's specifically focused on providing care to children who are born with cleft lip and palate. And Operation Smile itself has provided surgery to over 300,000 children around the world. But then I work with them to advise them on specific programs in countries here in Africa that will focus around training more healthcare workers to address the problem at the root cause, but also partnering with hospitals to increase their capacity to provide more and safe surgery. The advice that I would give is, it's a bit pessimistic, but I want to tell you to expect and anticipate adversity ahead. If you want to have big impact on a big scale, it's not going to be easy. So expect that getting to those goals will be extremely challenging. Once you set those expectations, anything that comes at you, you will be able to overcome. But also, my other advice is to work extremely hard and to work extremely hard. That is the least that you can do in trying to in trying to attain impact. If you're trying to have a big impact, and big impact means addressing big problems, you also need to have big ideas and big solutions to address those problems. And often, I think big impact that addresses big problems require big solutions, but also severe adversity. That's the advice I would give is to work extremely hard, but then you need to think big if you want to address big problems.